Good afternoon, all. I'm Dr. Vanaja Shivkumar from Management Maternity Home from Bangalore. Yeah, nowadays we come across too many polycystic ovarian syndrome cases, and all the every alternate adolescent will have this problem, and frequently they'll be coming to the clinic. So, is it a polycystic ovarian disease or a syndrome? Yeah, it is no more called as disease because it is a syndrome because it includes too many pathognomonic factors. What is this polycystic ovarian syndrome? Why does it occur? Yeah, this syndrome, it involves too many pathologies, and the causes mainly because of the newer generation, the lifestyle changes, the sedentary work, and these adolescent girls are not aware of the diet nowadays because they are more towards the junk food. So mainly the lack of antioxidants, more of stress factors because they don't plan the things properly. Everything they do it at late, like they don't do anything on time, everything at late, so they get stressed up themselves. And also no sound sleep because late night they sleep and wake up in the morning they'll have disturbed sleep. So all this may increase their androgenic levels in the body. So on the top of it, because of their lifestyle management and their bad diet habit, they may put on weight. So overweight and the sedentary work is the main cause for this polycystic ovarian syndrome. So what happens if they are obese? The more of androgens are released in the body. So what is this polycystic ovarian syndrome? It is mainly the hirsutism. The symptoms of hirsutism is again the irregular hair growth in the male pattern in the body of the young adolescent girls, and also the ovulatory dysfunctions like the menstrual irregularities and the immature follicles, that is the arrested growth of the follicles in the ovary. So it is not a polycyst in the ovary, it is the arrested follicles in the ovary because of increased luteinizing hormone in the body. So these three symptoms will name them as polycystic ovarian syndrome. Any two out of this is enough to diagnose polycystic ovarian syndrome. So on the other hand, we'll also have this Rotterdam criteria. What is this Rotterdam criteria? Hyperandrogenic level, menstrual irregularities, and the scan related documentation. The two out of these three findings is more than sufficient to name them as polycystic ovarian syndrome. So how to come out of it? See, as soon as the adolescent age group or the reproductive age group females, as soon as they feel something is going wrong in their body, irregularities, and there is a change in their look, they need to meet us immediately so that we can do counseling and counsel them regarding their lifestyle changes, diet, exercise. So their weight will start reducing, and on the simultaneously we can treat them with anti-androgenic drugs like cyproterone acetate, and also the insulin resistant. To reduce their insulin resistant, we can give metformin. So we have too many good drugs like the crimson 35, and 35, and so on and so forth. So that counseling and the medication will definitely, they'll get rid of this polycystic ovarian syndrome. So I once again advise almost all the adolescent girls should not meet us late, because once they get into this alopecia, that is frontal baldness, and the unusual hair growth over the body or the chin or the face, and acne, that is, in the polycystic ovarian syndrome, they'll get the scarring acne. So the whole beauty will go. So once they get into all this, and if they come in advanced stage, it is very difficult for us to treat. If they come well in advance, definitely they can change their lifestyle, they can maintain their beauty, and they can get rid of this polycystic ovarian syndrome. And the people who are in adolescent, this reproductive age group, they can still avoid their infertility issues. Polycystic ovarian syndrome, mainly the luteinizing hormone will act on the ovary, and it will increase the anti-Mullerian hormone in the ovary, and thus it causes the infertility, main infertility. And the increased endometrial thickness will again increase the estrogen level, and that estrogen will again causes insulin resistance and irregular bleeding, and again the chances of endometrial cancer and so many complications. So even they are in the reproductive age group, and the young adolescents kindly meet on time to have a proper treatment and get rid of this polycystic ovarian syndrome. Thank you.